On this Wednesday night, how vaccines will roll out. One potential vaccine moves a step closer to approval. What's Canada's inoculation plan?
We expect to receive 4 million doses between January and March of the Pfizer vaccine, 2 million for Moderna.
A nightmare situation in the north. COVID-19 spreads through communities in Nunavut.
We did know they would rise once the virus was in the territory.
The challenge of containing the virus and treating patients in such remote places. Plus, do-it-yourself an at-home COVID-19 test approved for use in the U.S.
If everyone could spit on a piece of paper every day and check themselves for COVID, we would catch cases.
How reliable are they, and will they be available in Canada? And learning about long-term immunity.
So the data are very promising, but we should be still taking precautions.
Evidence immunity to the coronavirus might last months or possibly years.
Global National with Donna Friesen.
Good evening and thanks for joining us. There is lots to get to tonight, but we begin on a rare positive note. It's about a possible vaccine for COVID-19. Pfizer and BioNTech say their final analysis of the vaccine they've been testing shows it is more effective than expected. The phase 3 clinical trial involving nearly 44,000 people is now complete, and the companies say the data shows it is 95% effective, up from 90% the preliminary data showed last week. And in people over the age of 65, the vaccine is 94% effective. The companies say there were no serious side effects. The results still need to be independently analyzed, but Pfizer says it plans to apply for emergency U.S. authorization within days. Canada has pre-ordered millions of doses of the Pfizer vaccine. It is being reviewed by Health Canada through an expedited process. If all goes smoothly, the first shipments could arrive in the first few months of 2021. But there are lots of steps along the way, and even if it gets approved, not everyone will get it right away. In our top story tonight, Mike Drolet looks at the plans for vaccine rollout in Canada.
Vaccine anticipation hit a fevered pitch in recent weeks. Are they effective? And if so, when would we see them? Well, today, Canadians were given the most definitive date yet to circle on their calendars.
The doses for Canada, we expect to receive 4 million doses between January and March of the Pfizer vaccine, 2 million for Moderna.
So that's 2 different vaccines, with possibly more becoming available soon, which epidemiologists say is important because not every vaccine works well for everyone. And the Pfizer product in particular has its limitations.
A significant fly in the ointment with the Pfizer vaccine is it needs to be stored at incredibly cold temperatures. And, very few places have the facilities for such a deep freeze. So there's a lot of obstacles that really have to be surmounted with this.
The obvious issue is a limited number of doses available right away. So a tentative rollout plan would look something like this. Canadians at high risk, be it elderly or those with high-risk conditions, would get it first, followed by frontline workers, which includes workers in healthcare and long-term care facilities, as well as people living with high-risk individuals. The third group would be workers essential to society, such as police, firefighters, and grocery store staff. Fourth, high-risk zones like Indigenous communities. With 2 autoimmune diseases, Georgina Monteith qualifies for the first group, but says she'll decline. She lost both her legs to diabetes, and with a compromised immune system, she doesn't trust any new medication in her system.
I don't want to have any kind of a adverse reaction to the vaccine where my body itself starts thinking this is something it needs to attack, or the vaccine does the reverse and attacks something in my own system.
Initial reports show the vaccine is effective with few side effects. So as much as the disbursement has to be fair, the government also has to communicate how safe it is. And realistically, even with the vaccine, we won't get rid of COVID-19 overnight.
We're going to have to wear masks and keep our distance and limit gatherings and stuff well into next fall, probably. Because it's going to take a while to get immunogenic saturation in the population to reach herd immunity.
Mike Drolet, Global News, Toronto.
Here are the latest numbers on how COVID-19 is spreading right now. They paint a worrying picture. In the last day in Ontario, more than 1,400 people tested positive and 32 people died. In the rest of the country, Manitoba reported 400 new cases today and 11 more deaths. That is a record high. BC broke yet another daily record today, more than 760 new cases. And in Nunavut, 10 more people tested positive. This is what the map looks like, adjusted for population. Manitoba still has the most active cases per capita, 519 cases per 100,000 people. And Nunavut, which 2 weeks ago had no cases, is now a hotspot, the fourth hardest hit region per capita in Canada. There are now 70 active cases in Nunavut. The entire territory is under tight restrictions for the next 2 weeks. Eric Sorensen on the risks of the coronavirus spreading in Canada's most remote communities.
For months, isolation was a great defense against COVID-19. But once the virus slipped into Canada's largest territory, isolation became a disadvantage. The worst outbreak is in Arviat, a community of more than 2,600. Like much of Nunavut, Arviat is accessible only by air or snowmobile, often with large families living in small houses and with limited healthcare resources. Much of the outbreak is along western Hudson Bay. Arviat has diagnosed 8 new COVID-19 cases and now has 54. Whale Cove has 8 cases. The largest community in the area, Rankin Inlet, now has 6, and Sanikiluaq has 2. So far, 70 in a matter of days.
This is it, folks. It's time to take a stand and fight against COVID-19. We need you all to make sacrifices now to protect our communities.
That sacrifice means a 2-week lockdown for all communities in Nunavut. Except for essential workers and essential needs, the people are being told to stay home, not socialize, not travel. Premier Joe Savikatak told Global News they can handle 4 communities, but not much more.
If it gets any more than that, then our resources would be beyond. We'd need more resources. Right now, we are pretty well at the limit of our resources in dealing with 4 communities.
Most communities in the north have at most a health center, such as this in Rankin Inlet. The seriously ill would have to be flown out.
If anybody is in that situation where they need ongoing fluid, oxygen, or life support, then they obviously can't stay in a health center and will need to go to a southern hospital.
Ottawa has helped with more testing capacity. It's also prepared to move COVID patients from their homes if the virus keeps spreading.
That involves repurposing schools in some cases, repurposing community centers to make sure there's isolation and testing capacity. And it's something that we're very, very worried about, particularly since you have people of many generations living under one roof.
If necessary, the military can and would be sent north. It's hoped it won't come to that.
What we're watching for right now is the numbers. If we can get the numbers to be low or stay stagnant, then we know there's no community spread.
The next 2 weeks will be nervous ones as Nunavut waits to see if the lockdown can curb the outbreak. Eric Sorensen, Global News, Toronto.
Global News has confirmed the U.S.-Canada border will remain closed to all non-essential travel until at least December 21st. And today, BC's Premier said people shouldn't be traveling in or out of British Columbia unless it's essential.
We need a pan-Canadian approach to travel. We need to make sure that people in Coquitlam are living under the same rules as people in Chicoutimi. We need to make sure that those who want to come to British Columbia must only do so if it is essential for their business or their well-being.
It's not an order, it's an ask. Premier Horgan says he plans to call on the Prime Minister and other premiers to actively discourage people from traveling outside their home province. The U.S. Food and Drug Administration has issued emergency use authorization for the first COVID-19 test kit that can be used at home. A prescription is needed for it. It uses a nasal swab and gives results in 30 minutes, and it could be used in emergency rooms and doctors' offices too. It's not approved for use in Canada, though there has been talk of a home test for months now. David Akin looks at where things stand.
Testing, testing, and more testing. It is the key to controlling community spread of COVID-19. That's because most of the community spread in Canada right now involves people who have no symptoms and, unaware of their condition, continue going about their daily routine and infecting others. Some say a rapid home test kit would help prevent those asymptomatic COVID-19 carriers from spreading it around because they know to stay home and self-isolate.
We could open up businesses. If everyone could spit on a piece of paper every day and check themselves for COVID, we would catch cases. We wouldn't catch all of them, but we would catch enough that we could open up. We could do that, but that actually would require federal leadership.
Health Canada has approved a handful of rapid test kits, but those can only be used by healthcare professionals. Health Canada has neither approved nor is currently evaluating any rapid home test kits. Meanwhile, the United States Food and Drug Administration this week announced it had approved yet another home test kit. Canada has asked that manufacturer and others to consider submitting their kits to Canadian regulators.
At the end of the day, you can't rush science, and I would just say that if there are promising manufacturers out there that have not submitted to Canada, they certainly should, and we will take a look at them very quickly.
If those test makers do submit their products to Health Canada, experts hope approval is in fact speedy.
The tests are getting better, and over time, the false positivity rate is declining.
Canada is now testing about 58,000 people a day, but experts say 200,000 a day need to be tested. And rapid tests, including rapid home tests, will be critical in meeting that testing capacity. David Akin, Global News, Ottawa.
Ontario's education minister says the province's schools are staying open and will not have an extended Christmas break. Earlier this week, Stephen Lecce said adding 2 weeks onto the Christmas break was being considered. Today, he said it's not warranted because, according to him, schools have been remarkably successful at minimizing outbreaks.
The safest place with the cohorts are in schools, and so far, I'm knock on wood, it's working. Over 99% of the kids are COVID-free, and that's the same with staff. So that's the safest place.
In New York City, though, public schools are closing tomorrow. More than 1 million students in the nation's largest school district will move back to remote learning. New York has reached a 3% test positivity rate, though transmission levels within schools are low, and many parents are now scrambling to cope with having kids at home. Across the U.S., COVID-19 case numbers are at record levels. More than 136,000 new cases were reported today, and more than 1,500 people died. And the U.S. hit a new milestone today. 250,000 people have now died of COVID-19 since the start of the pandemic. As case numbers and deaths soar, President Donald Trump is still refusing to accept the election results and refusing to cooperate in a transition to President-elect Joe Biden. Instead, Trump fired the top official in charge of election security, and he seems intent on spending his final days in office ridding the administration of officials he sees as insufficiently loyal. Jackson Prosco reports.
In an unprecedented move,
this is a disgrace.
The Board of Elections in Wayne County, Michigan, initially refused to certify its election results.
Shame on you. Shame on you for leading to this level of corruption. You have disavowed your right to even sit in the seats that you occupy.
2 Republican members tried to block the process, claiming widespread irregularities that echoed President Donald Trump's baseless claims. In the end, they relented. But soon after, Trump's effort to discredit the vote claimed a new victim.
Be prepared for efforts that call into question the legitimacy of the election.
That's Christopher Krebs, who oversaw the agency tasked with election security. He was fired by Trump late Tuesday after openly debunking every one of the president's lies about widespread voter fraud. There is no evidence that any voting system deleted or lost votes, changed votes, or was in any way compromised, read one statement issued by Krebs' agency.
Trump is just moving any person out of the way that has any kind of institutional power to check him.
Well, that's the president's right to do it.
Still, Republicans are standing by their man, refusing to acknowledge Joe Biden as president-elect.
I don't think we're going to have an interrupted transition to whoever is the next administration.
But the transition is being delayed by Trump's intransigence. Biden's team says it can't access critical data about the response to the COVID-19 pandemic, like plans to distribute a vaccine.
Which, unless it's made available soon, we're going to be behind by weeks or months being able to put together the whole initiative.
And as the pandemic rages unchecked in this country, the current president is facing pressure to deal with reality. Members of the White House Coronavirus Task Force have reportedly told the president he needs to change course to avoid a catastrophic daily death toll. Donna.
All right, Jackson Prosco in Washington, thanks. In Berlin, Germany, police in riot gear broke up a big demonstration of people angry about the government's plan to enshrine COVID-19 restrictions in law. Police used water cannon to disperse a crowd of thousands of people near Berlin's landmark Brandenburg Gate. They moved in after demonstrators ignored calls to wear masks and keep their distance. Protesters threw flares and set off smoke bombs. At least 200 people were detained. German lawmakers are debating a bill that would strengthen government powers to impose further pandemic restrictions. Critics say the law would endanger citizens' civil rights. Germany has almost 300,000 active COVID-19 cases and more than 13,000 people have died. Leading the way, coming up, Vancouver's plan to decriminalize simple possession of hard drugs. Plus, back in the sky, the news Boeing was waiting for. The overdose crisis in this country has not gone away. During the pandemic, in fact, it is getting worse. Tonight, Vancouver's mayor is calling for a new approach. Kennedy Stewart wants to decriminalize the simple possession of hard drugs in his city. If approved by the federal government, it will be a first for Canada. Global's Jordan Armstrong is in Vancouver. Jordan.
Donna, saying drug use isn't a criminal issue but a health one, Vancouver's mayor is calling for a new approach. Kennedy Stewart says there have been more than 1,500 overdose deaths in Vancouver since April 2016, when a public health emergency was declared in BC. And he wants the federal government to decriminalize the simple possession of illicit drugs. If Vancouver Council backs him, the mayor says he'll write a letter to federal officials requesting an exemption to the Controlled Drugs and Substances Act, an exemption that would end at Vancouver's boundaries.
This is one tool in a series of tools. For example, safe supply is also a critical component of reducing overdoses and overdose deaths. But what's so important about decriminalization is it starts to stop the stigma, reduce the stigma around drug use, and that means people are more likely to access essential health services.
Kennedy Stewart isn't alone. BC's premier supports the idea, as does the Canadian Association of Chiefs of Police. The head of that association is Vancouver Police Chief Adam Palmer. But of course, it isn't up to them. Ottawa must be convinced. And as recently as September, the Prime Minister rejected calls to decriminalize possession, saying the idea is not a silver bullet. Donna.
Okay, Jordan Armstrong in Vancouver tonight. Thanks. Still ahead, when Boeing 737 MAX jets will fly again in Canada. The U.S. has cleared Boeing 737 MAX jets for takeoff, but at this point, Canada is not following suit. The U.S. Federal Aviation Administration says airlines in the U.S. will be able to fly the MAX series after Boeing updates critical software on each plane and pilots receive training. Canadian restrictions remain in place while Transport Canada finishes its own investigation. In a statement, the Transport Minister says Canada will impose different requirements for operators, including additional flight deck and pre-flight procedures, as well as different training. The 737 MAX jets have been grounded since March of 2019 after 2 deadly crashes killed more than 340 people, including 18 Canadians. Next, the study raising hopes about COVID-19 immunity.
You're watching Global National.
It can be hard to find hopeful news these days, but there is a potential bright spot tonight. It's a study about immunity, the most comprehensive and long-ranging study of immune memory to the coronavirus. It hasn't been peer-reviewed or published in a scientific journal, so it needs scrutiny. But it found most patients who recover from the virus still have good immunity 6 months later and possibly longer. Heather Urix-West explains what we know and don't know.
Luann Carl was on a camping trip with her husband last summer when she became ill with COVID-19.
My husband, Russ, who was also positive but had a mild case, he had to help me walk. He had to wash my hair. I couldn't even sit up. I was that weak.
Carl says the experience was frightening and one she never wants to repeat. New data suggests, at least in the short term, she likely won't have to.
This is a really good news story. It tells us that the immune response is behaving as exactly as our textbooks tell us that it should.
Researchers from the La Jolla Institute of Immunology collected blood samples from 185 people who had recovered from mostly mild cases of COVID-19. They then tracked 4 components of the person's immune response: antibodies, 2 types of T cells, and B cells. At the end of 6 months, they found most patients still had strong immunity against reinfection.
This is important data to take us forward to better understand the long-term immune response to SARS-CoV-2 or the COVID-19 virus, but not definitive at this stage.
That's because not every person's immune system will react the same way. And so while reinfection may be unlikely, it's never impossible. And there's another big question as well.
How does the state of immunity in URI, if we've been infected with SARS-CoV-2, does that make us less likely to transmit the virus if we come in contact with it again to somebody else?
That means you might be immune and still have the ability to make someone else sick. It's why, even with this hopeful news, Carl isn't taking any chances.
We just don't know, and to be safe is a really easy thing to do.
Heather Urix, West Global News, Calgary.
And that is Global National for this Wednesday. I'm Donna Friesen. Tonight's Your Canada is this view of Lake Erie from Chatham, Kent, Ontario. We'd love to see your part of this beautiful country. Email Your Canada to viewers@globalnational.com. Thanks for watching. I'll see you back here tomorrow. Take care of yourselves. Bye-bye.